Hi there, I'm Rebecca Shatsky. I am the Breast Medical Oncology Team Leader at UC San Diego and Director of the Inflammatory and Triple-Negative Breast Cancer Program there as well. So today, I'd like to talk about my highlights from this ASCO 2025, which was super exciting as far as the breast cancer realm. I'm also an editorial board member of Breast Cancer Today, and excited to speak with you all. Amongst triple-negative breast cancer, which is near and dear to my heart, I was really excited about this meeting because the ASCENT-04 data, which is Sacituzumab plus Pembrolizumab for PD-L1 positive triple-negative breast cancer in the first-line setting, I believe, so this was a positive trial. And it showed that Sacituzumab improved progression-free survival versus chemotherapy plus Pembrolizumab. The chemotherapies generally used in that setting were derived from the KEYNOTE-355 trial, which was carboplatin gemcitabine versus a taxane, either Abraxane or just standard paclitaxel. And what we saw is that the combination of Sacituzumab plus Pembrolizumab for the PD-L1 positive group really improved progression-free survival and overall survival, which is still immature a little bit at this point, but it's looking really, really good. Now, I think this is super important because in the KEYNOTE-522 era, which in the United States is absolutely the standard of care for stage 2 and 3 triple-negative breast cancer, which combines a backbone of carboplatin, paclitaxel, pembrolizumab, and adriamycin, Cytoxan, pembrolizumab. So that is really, since Peter Schmidt presented that data and it was published in the New England Journal of Medicine, been the standard of care in the United States for a while now. And when we think about the patients, the majority of those who got curative intent treatment, but then relapsed, sometimes very quickly after their curative intent treatment, we need to know that that patient population tends to be already resistant to taxanes and platinum backbones. So the TROP2 directed antibody with a SN38 payload, that ADC, which is a topoisomerase 1 inhibitor payload, it makes sense to move that into the first line instead of the second and the third line for patients, because I find that I get much worse results actually than the KEYNOTE-355 trial when I'm using those in the standard first line setting. So I've been waiting for this to move forward and be approved in that setting for a while. We already know that the ASCENT-03 data is positive as well from a press release from Gilead. And so that will also kind of add to this as soon as that phase 3 result is presented as well. And so we're going to have Sacituzumab govitecan really be the standard of care first line therapy for metastatic triple negative breast cancer.